You know, the most important parts, or one of the most important parts of our body system is the vascular system. And making sure that it's healthy is important, but what do you do if you end up having some issues? You have to have surgery. Well, what are some of the things that you have to watch out for? Well, today on the show, we're talking with Dr. Brooks Gray.
Hey,
how
Jim.
are you?
Good, good.
With
How
South
are you?
Mississippi Surgical Center. I'm well, thank you. And I mean, your vascular system, and it's throughout your body. But we're going to kind of break it down into a few different things, and one of the most important ones is the carotid system in your body.
Correct. The carotids are the arteries that are the primary blood supply to the brain. You can often have issues or problems that are unknowing to the patient.
Mm-hmm.
Some of the symptoms to be aware of are facial tingling or numbness, weakness in an arm or leg that's temporary that tends to resolve over time, unilateral eye blindness that typically lasts from a couple of minutes to 20 minutes or so and typically resolves. Those are typical TIA or mini stroke type symptoms and certainly important warning signs to tell you to notify your physician and get those looked into promptly.
Now, I've had a TIA. I mean, it's been several years ago. So, you know, of course, after being treated for it and everything, I had to change my lifestyle, so to speak.
Sure.
So, and I haven't had one since. And I've been, I would say, really fairly healthy then. But those are little things that you need to watch out for because it could lead to something bigger.
Correct. Warning signs. Typically, those patients are seen and evaluated to include tests such as Doppler studies of your carotids. It's basically an ultrasound. It's non-invasive. You may, upon evaluation, not have severe disease that requires surgery, but it's typically recommended that those patients get surveillance studies, which will entail those ultrasounds, usually at 6-month intervals. If you have some disease, probably for lifelong surveillance.
And anybody that's seen, they do an ultrasound for a woman who's pregnant with a thing, but it's pretty much the same thing for a carotid. They put the gel on you, and you basically go around there and you can look at a monitor and exactly see what's going on.
Exactly, the degree of stenosis and the velocities associated with the flow through those areas. And the ultrasound is a great test in vascular disease. We use it for the carotids and evaluation of abdominal aortic aneurysms. And also evaluation of peripheral disease, the legs and blockages there.
So what about, you mentioned the abdominal aortic problems there. Are there some different symptoms that someone should be aware of that they could watch out for?
Sure. Unfortunately, the aneurysms often, it's totally asymptomatic until you have an issue. But there are certain patients that have risk factors that would be deemed high risk and require evaluation. Typically, the first test to evaluate it is abdominal ultrasound. Again, non-invasive, inexpensive test. Depending on the size and location and symptoms, intervention potentially can be required. The good news is in the last 10 years or so, we've approached these differently. It used to be a large abdominal operation with a week or more in the hospital. Now we can do it endovascularly with either small incisions or totally percutaneously. Repair the aneurysm from the inside of the vessel by deployment of a graft. And most times those patients can go home the next day, don't require blood transfusions. Recuperation is dramatically less than the traditional procedures.
How about peripheral vascular diseases?
And that's another, the aging population and the diet that we enjoy here in the South, those
which isn't very good at times.
are increasing and typically involves initial evaluation with the ultrasound and blood pressure cuffs on the legs. It can tell you the amount of flow getting to the legs. These patients often describe pain, discomfort, or tiredness in the calves, thighs, or buttocks. There can be other things, potentially musculoskeletal, hips, spinal stenosis that can cause similar symptoms, but an evaluation and ultrasound of the arterial tree would be a diagnostic test that could point you in the right direction in dealing with that. And that's another aspect of vascular surgery that we can approach endovascularly. Small puncture wounds in the groins, fix these blockages from the inside of the vessel with the angioplasty, similar to the coronaries or the heart vessels, deploying a stent if needed, and also utilizing a device that debulks or removes a portion of the plaque called an atherectomy device. So it's really exciting. Vascular surgery has a lot of new technology that's allowing you to treat more complex disease processes a lot easier with shorter recuperation times for these patients, salvaging legs and getting them back to the lifestyle they want to.
And I guess the deep venous thrombosis kind of falls in amongst all those as well.
It is. That's a common problem. It's usually described as pain, discomfort, and swelling in an extremity. It's also something that should prompt evaluation, particularly if it's one leg by a physician or even the ER if needed. It's diagnosed also with ultrasound. Treatment typically is medical, though there's some devices available now that can allow you to remove some of the clot. There's medications that can aid in breaking up the clot, and some patients can benefit from the placement of a retrievable inferior vena cava filter device. It protects you if this clot were to migrate or move toward the heart or lungs, which it kills about 200,000 people a year.
That's something. Now, are there people with certain lifestyles or daily habits that have more apt of a chance to developing some of these things,
Sure.
like people who sit at desks all the time or whatever?
Well, for the blood clots, certainly immobility, orthopedic procedures, age.
Because you hear about that a lot. People flying on planes,
Right.
They get a blood clot or something.
Right, and that would fall into the immobility realm. Certainly, I'd encourage you, if you're going to be prolonged immobile or traveling, just doing your legs back and forth, contracting your calves, every few minutes would offer some benefit. That contractility improves venous return. But yeah, DVT gets a lot of press, and it's tragic when you have a death, particularly if it's diagnosed and potentially treatable.
Yeah, and again, I mean, it's simple things that you could really do to help yourself. As you said, get up, move around. If you're doing a long, it doesn't have to be on an airplane. If you're on a long road trip, something like that, traveling across the country or whatever. And I'm sure the older that we get, more of an opportunity that we do have for this to develop.
Right, and certainly age is a risk factor
Yeah.
for that. And for some of your peripheral disease, hypertension, diabetes, high cholesterol, genetics is a huge component which you have no control over. The other three you do, and certainly cigarette smoking is a big contributor.
So that contributes to everything.
Right,
it seems to.
right. Keeps vascular surgeons busy.
Busy.
Right.
It keeps and I hate to say it's job security for you.
Unfortunately, correct.
Dr. Gray, thank you so much.
It's a pleasure. I appreciate the
I
opportunity.
appreciate your time. Again, if you'd like some more information, one of the things you need to do if you're having any of these symptoms, go to your general practitioner. Be sure you get a thorough checkup, and then they will probably, if need to, recommend you to someone. And it's great to call and find out more information with the South Mississippi Surgical Centers here along the Mississippi Gulf Coast. Dr. Gray, one of many great surgeons that they have on their staff. Give them a call.